Calcium channel blockers are widely used in the treatment of angina and have fewer serious side effects than beta blockers. Calcium channel blockers inhibit L-type voltage-sensitive calcium channels in arterial smooth muscle, causing relaxation and vasodilatation. Preload is not significantly affected. Calcium channels in the myocardium and conducting tissues of the heart are also affected by calcium channel blockers, which produce a negative inotropic effect by reducing calcium influx during the plateau phase of the action potential. However, the dihydropyridines, for example nifedipine and amlodipine, have relatively little effect on the heart because they have a much higher affinity for channels in the inactivated state. Such channels are more frequent in vascular muscle because it is relatively more depolarized than cardiac muscle membrane potential 50 mV to 80 mV. Furthermore, at clinical doses, vasodilatation results in a reflex increase in sympathetic tone that causes a mild tachycardia and counteracts the mild negative inotropic effect. Amlodipine, which has a long duration of action, produces less tachycardia than nifedipine. Verapamil and, to a lesser extent, diltiazem depress the sinus node, causing a mild resting bradycardia. Verapamil binds preferentially to open channels and is less affected by the membrane potential. Conduction in the atrioventricular node is slowed, and because the effect of verapamil, unlike nifedipine, is frequency dependent, it effectively slows the ventricular rate in atrial arrhythmias. The negative inotropic effects of verapamil and diltiazem are partially offset by the reflex increase in adrenergic tone and the decrease in afterload. Diltiazem has actions intermediate between those of verapamil and nifedipine and is popular in the treatment of angina because it does not cause tachycardia. Tobacco smoking. Smoking is prothrombotic and atherogenic. It reduces coronary blood flow, and the nicotine-induced rise in heart rate and blood pressure increases the oxygen demand of the heart. In addition, the formation of carboxyhemoglobin reduces the oxygen-carrying capacity of the blood. Some patients improve remarkably on giving up smoking. So, up until now, we have discussed 3 major classes to treat anti-anginal drugs. But in the last section, we will also discuss some revascularization procedures, so stay with us.